Good afternoon, everyone. I'd like to welcome you today to our webinar presented by Healthcare Can, the national voice of Canada's hospitals and healthcare organizations, in collaboration with the J.W. MacDonald Family Foundation. As you know, the topic of today's webinar is the role of food in healthcare. Healthcare Can regularly hosts webinars on a wide range of policy topics for our members and for other stakeholders, and this is one in a series. My name is Jennifer Kitts, and I'm the Director of Policy and Strategy at Healthcare Can. And I just wanted to say a few logistical words before we get started. First, I want to point out that if you happen to experience any technical issues during the webinar, please contact the name Kathleen Van Loon. The number is on the screen, and the number was also provided to you in the details, the call-in details that you received earlier this week. So I'm going to briefly walk you through some of the features of the technology. First, because the webinar is being recorded, all lines have been muted to avoid distracting background noises. Only our speakers will be able to speak. If you have a question or feedback, please feel free to enter it into the Q&A pod, which is on the right-hand side of the screen, at any time during the presentation. We'll have some time at the end of the presentations for feedback and questions. As well, I want to point out that as part of our evaluation form this time, we have asked a few strategic questions to help inform our research in this area. So we really appreciate you taking a moment to fill out the evaluation form and provide some input, because many of the people on the line today are experts working directly in this area. So as I said, we have 4 presenters. Our first presenter today will be Healthcare Can's CEO, Mr. Bill Thal. Healthcare Can, with support from the J.W. MacDonald Foundation, is currently conducting research on this role of food in healthcare. And this research, you'll learn about this research from our second presenter, Tracy, and will be presented to the board, our board, Healthcare Can's board, in June and shared with our members. Mr. Thal will be providing a background on Healthcare Can and why this topic is of interest and importance to us and our members. Following Bill's presentation, we'll hear from our partners, the J.W. MacDonald Family Foundation, Ms. Beth Hunter. The foundation has played a leadership role in this area, and Beth herself has a great deal of expertise in this area, so she'll be sharing some details about the initiatives at the foundation. Beth's presentation will be followed by Tracy Murphy, who's a consultant for Healthcare Can. As I mentioned, we are doing this research paper on this topic, and Tracy has been our lead. She'll be sharing preliminary results of our research. And as I said, you will also have an opportunity to provide input at the end of this webinar. Last but certainly not least, we're delighted to also have Brenda MacDonald. Brenda has extensive experience in Nova Scotia and at both IWK and presently at the Nova Scotia Health Authority. And Brenda will be sharing some of her insights from her experience. So without further ado, I'm very pleased to introduce Healthcare Can CEO, Mr. Bill Thal.
Thanks very much, Jennifer. Merci beaucoup, Jennifer. Bonjour à tous et bienvenue à ce webinaire. That's it for the French for me, although we are able to respond to questions in French if you feel more comfortable asking in French. So, as Jennifer said, this is the most recent in our series of webinars. We've had in the last 6 or so months webinars in the areas of antimicrobial stewardship, frailty and frailty assessment screening, drug regulations, including Vanessa's Law, and of course most recently we've had a webinar in the important emerging area of opioids. A few comments or just to set the context in terms of Healthcare Can. Healthcare Can is a national organization representing regional health authorities literally from one end of the country to the other, right from Vancouver, Island Health Authority right out to Eastern Regional Health Authority in Newfoundland and Labrador. And here in Ontario, most of the academic healthcare organizations in Ontario and hospitals in Ontario. You'll see in the next slide just a visual of our 52 or 53 members. That does not include our affiliate members or our associate members, which are we're reaching out to in a number of areas. Healthcare Canada's goals in the area of food nutrition management, which would be the next slide there. Charlie, please. Thank you. Just to set the context here, this issue, the issue around nutrition, good nutrition and health in Canadian hospitals or healthcare environments, came to our board last October as a priority issue. It was brought to our board. Sorry, we got a little bit of stuff going on here.
We're just making sure that the sound is okay.
Is the sound okay? I guess you guys can't answer. But in terms of setting the context, this came to our board last October based on our partnership, our valued partnership with the MacDonald Family Foundation and the ongoing work that we're doing there, and you'll hear more about this later from Beth in terms of the Nourish program. But I think the board recognized pretty quickly that nutrition wasn't just sort of something you thought of as a utility, quote unquote, in our healthcare system. That it is important to ongoing health of Canadians as physiotherapy is upon discharge, or good discharge planning, generally speaking, or drug and drug interactions. And as people enter the hospital or exit the hospital, we need to bear in mind that nutrition is just vitally important. Eat good, feel great is what we used to say when I was at Health and Welfare Canada. Just to add further to that, I just came back from annual meetings of the American Hospital Association in Washington, where again, value-based healthcare systems are sort of the talk of the town. Accountable healthcare organizations are a destination for many hospitals. And again, nutrition is seen as one of those things that if you're interested and concerned about patient-centered healthcare, you got to be worried about nutrition. Next to buzzer time, nutrition and good food in Canadian hospitals is really important. Another dimension to all of this that was important to our board as we embraced doing more to better understand the issues and some of the options, scaling up those options and spreading those leading practices better. Another important aspect of this was the whole area of traditional health care for our Indigenous people and access to traditional foods. I can tell you that's a huge priority for Indigenous health leaders across the country, and a huge challenge in terms of some of the regulations that we have in place. So that maybe helps you to better understand why this is a priority for Healthcare Canada at this time. We also recognize, just back to the other one there for a second, Charlie, that Healthcare Canada is uniquely situated because of the breadth and depth of our membership. You're going to hear from Brenda a little later today. Well, Nova Scotia Health Authority is the health authority for Nova Scotia. And so we have a tremendous, with that representation comes a responsibility to try and leverage up that span across Canada and to counter what I call affectionately NIH, not invented here syndrome. We need to do a better job of scaling up and spreading innovative practices, such as the one you're going to hear later from Nova Scotia and our colleague Brenda. The last one. So whenever you're identifying sort of a set of policy issues, your first job is to kind of get a really good diagnostic. As I learned for working with the Physicians of Canada for many, many years, 90% of getting the treatment right is getting the diagnosis right. So the issues and options piece that you're going to hear a little more about in a minute is all about getting a better handle on what are the issues, what's the nature and complexity of some of the issues around better nutrition in Canadian hospitals. And so the intent then is to, once we've got all the comments in, is to take this issues and options piece that Tracy's going to be presenting to you momentarily, take that back to our board in June, and then look at what more specifically Healthcare can do. And can do in a whole number of areas, but one of them is we have the longest standing and has put more students through in terms of our food, nutrition, and management services program, going back, Dale was telling me, to 1968. And so we work very, very closely with the accrediting organization, the Canadian Society of Nutrition Managers. Did I get that right? So it's a credential program. It's been around since 1968. And as I was kidding earlier on, we've moved exclusively to kind of online, on-demand training programs to allow for the flexibility that adult learners need. But I was kidding a little earlier. I think I gave my first and last speech 3 years ago when I took over this job to the FSMAC group over here at the Chateau Laurier, and I guess I must have sort of helped seal the deal in terms of moving to online distance learning. So again, last point would be we couldn't find any better partners than our partners at the MacDonald Family Foundation, not only in this particular area, but more broadly in terms of Indigenous health and doing more to address serious health gaps, beginning with addressing some of the gaps in terms of good nutrition programs and policies. So with that as an introduction, again, thanks to everybody who's been involved to this point, and I'll kick it back to Jennifer to hear from the important people.
Thank you very much, Bill. That was a terrific introduction to why this issue is of such importance to Healthcare Can. So as Bill mentioned, I'd now like to turn it over to Beth Hunter, who's the Program Director at the J.W. MacDonald Family Foundation. As I mentioned at the outset, she's not just a supporter and funder of this work, but she has enormous expertise in this topic, and we're delighted to have her say some opening words. Over to you, Beth.
Great. Thank you so much, Jennifer and Bill. First is to say that for those of you who don't know us, the MacDonald Foundation is a national Canadian foundation that works on systemic social and environmental problems, and we engage with partners as well as the public in initiatives that are aiming to generate lasting and scalable impact. So we really take a systems approach, and one of the about seven areas that we work on is sustainable food systems. And within that work, we have been really interested in the role of institutions as levers for change, as important change places, for basically since the beginning. And over the last couple of years, we've been working on this institutional food program in partnership with Food Secure Canada, which has supported 8 projects across Canada that are taking place in schools and hospitals and campuses to get more local, sustainable, delicious foods into those places. And the projects have wrapped up, and we've wrapped up the learnings from them in this report, which you can find on our website or our Food Secure Canada's website. One of the things that came out of that work was looking into what some of the gaps and opportunities were, and we were particularly interested in healthcare. And because it does present some particularly big gaps and opportunities. And so really our approach to this was, as we looked at what the barriers to purchasing local and sustainable food are in healthcare, is to see, first of all, that healthcare represents a very large part of the institutional food service sales. About a little under half of the institutional food service sales in Canada are coming from healthcare. So that was our question at that point, was what can healthcare do for the food system to make the food system more sustainable and resilient and healthy, and build local food economies. But really, as we looked further and further into healthcare, we realized that and that's based on the spend that I mentioned. It's estimated about $3.7 billion a year spent in Canada's hospitals and residential care facilities. But we also realized that there was a big question around what food can do for the healthcare system and for healthcare in general. And that really focuses a lot around the question of the chronic diseases, which we know are increasing about 14% a year, and that are having a heavy cost on our healthcare system and on government costs, as well as in general to the Canadian economy. So we wanted to look at what healthcare could do, the important role that it plays in addressing this. Not to say it's going to solve it alone, but that there's a real important role around shifting towards a more preventative approach and recognizing the role of food in that preventative approach. And also just in walking the talk, that, recognizing that, I think, as we all do, that food is an essential part of health, but then saying, well, we need to be walking the talk as in the facilities, if that's what we really believe. So I'm going to just quickly tell you about 3 local initiatives that we've been in contact with or supporting to give you a flavor of what this can look like. So this is from Alberta, from the local food group, which is coordinated by Northland in Edmonton, but which also includes Alberta Health Services. And what this group did was to define local and to look at how they could get more specifically local food into their buying streams, both engaging with new small local producers as well as using their existing procurement streams to get some of those new products into their facilities. And they're continuing to do that work. So this is one that we supported through that institutional food program that I was mentioning. In Northern Ontario, one of our current Nourish innovators, which I'll tell you about, Kathy Loon, is participating as part of the Menoyawan Health Center in Shoe Lookout. And in the Anishinaabe Nation language, Menoyawan means health, wellness, and well-being. And they have been really focusing in a very holistic way on how they can bring health in that holistic way to their patients and families and staff. One of the ways is around food. They've been serving wild meat to patients, staff, and visitors, over 5,000 trays of traditional food a year, and they're looking to expand and improve that. And then finally, south of the border, with our partners at Healthcare Without Harm, they have worked with a number of big hospitals and the biggest healthcare service company, Kaiser Permanente, to do some really important work around what they call less meat, better meat, looking at ways to reduce meat consumption and thus reduce the carbon footprint of it, but also to, in the meat that is served, to have it be more sustainably produced. And they particularly have been linking the clinical impacts of antimicrobial resistance to the hospital's purchasing power in sourcing antibiotic-free meats. So a few examples that, knowing that these projects are happening in a scattered way across the country, we really wanted to look at how we might be able to help scale them, what we call scaling out, as well as scaling up. So how we could help to multiply the number of people that are doing this kind of great work and provide support to them and to their projects, and multiply them. It's very much a program based on peer learning. So this is a picture of the 25 innovators that are part of the Nourish program, which we created as we look to work more on food and healthcare. And they are working on a really wide range of projects around, from increasing local, sustainable, delicious food, to hospital gardens, to decreasing waste through room service improvements or packaging reductions. And so they're committed to work for the next couple of years on their projects and to support each other as they develop them. So we're looking to do that, and at the same time to spread beyond this cohort, to share the learnings, and also to try and address some of the more systemic issues that are preventing them or making it really difficult for them to do this work. So we want to be building partnerships across the sector, and more broadly linking food and healthcare, which is really the context for our deep interest in working with Healthcare Can on deepening the exploration of what it could look like to improve the future of food in healthcare. So we are, and our central question around this is, how can food improve the patient experience, institutional culture, and community well-being? And we invite you to, if any of you are going to NHLC in Vancouver, there's going to be a workshop with a couple of our innovators that will be presented. And also on our website, there's not only information about these innovators and their projects, but also a lot of resource material, which you're most welcome to have a look at, and a newsletter, which you can sign up to. Yeah.
That's terrific. Thank you so much, Jess, and I'm really glad that you highlighted the fact that MacDonald and the Nourish project is going to have a concurrent session at our National Health Leadership Conference in Vancouver. It was interesting.
June 12th and 13th.
June 12th and 13th. And actually, we can even, in our follow-up, we'll send a link to that because it's relevant to this webinar. But it's terrific to hear about all the work that MacDonald's doing, and as we mentioned at the outset, we're very proud to be partnering with MacDonald on this research project and also on the Nourish, to partner on Nourish, so thank you for that collaboration. So before I turn it over to Tracy, I just want to say to all of our participants, please, if you have questions as we're going along, at any point you can type them in the Q&A pod. So if a question emerges when you listen to one of our speakers, please don't wait till the end. You can send them now. So Tracy Murphy is a consultant for Healthcare Can, and she, as I mentioned, she's been leading the research and interviews with key informants for this project. So without further ado, I'd like to turn it over to Tracy to describe her research and next steps. Over to you, Tracy.
Super. Thank you, Jennifer. I'm thrilled to be participating in this webinar today. This has been a very interesting project and an exciting one because there's a lot happening in food and healthcare and because there's a great deal of potential. So we're all familiar with the tremendous stresses on the healthcare system currently. Hospitals are definitely pressured to cut costs and find efficiencies while enhancing service delivery and improving patient outcomes. And at the same time, there's more focus on patient-centered care, we've heard that already today, and on value-based healthcare. And in this context, the way food in hospitals and other healthcare organizations is sourced, purchased, prepared, and delivered is changing. And while the impact of food on the bottom line remains at the fore, patient and employee health and satisfaction are seen as very significant. Many hospitals are trying to take a leadership role in advancing healthy eating. I'd say that awareness is spreading that good food in hospitals is part of health and healing, and at the same time that innovations are needed and spread is needed. Through this project, we attempted to better understand the current state of food in hospitals, as well as the barriers and opportunities to improving food in these institutions. And I'll talk about some of these during the session, and I'll also highlight some of the exciting innovations within both Canadian hospitals and internationally. Our steering committee of 10 people helped to scope the project, identify interviewees, and shape the interview guide. The committee has also advised on the development of the issue brief that's almost ready. We completed 14 key informant interviews. These folks included dietitians, food service managers, procurement specialists, food manufacturers and distributors, healthcare food consultants, and a chief of staff of a major urban hospital. In addition, we interviewed one key informant from the U.S. and one from the U.K. We also reviewed the literature pertaining to food and healthcare and food in hospitals, and of course we will weave all of these findings into the issue brief. And as Jennifer Kitts mentioned, any feedback that you as webinar participants today can provide to us through the electronic evaluation form that you'll receive will be considered in the final document to be released in June. So certainly we want to hear from you after this webinar today. There exist different perceptions about the current state of food and healthcare organizations in Canada. So the media, for example, tends to pick up on stories that highlight issues at opposite ends of the spectrum, such as patient complaints or hospitals doing great things like holding farmers markets for staff and visitors. Stakeholders closer to the issue told us that more attention is being paid to hospital food and that there are many initiatives underway to improve and advance healthy and nutritious food in their facilities. There's no denying the influence that economics and limited budgets have on food services. Some key informants characterize hospital food as a commodity or an amenity in the background, mainly a support function, and not necessarily one that is viewed as integral to patient care and recovery. Several key informants noted that food in hospitals often does not get the attention it deserves and is not on the same footing as other components of care, such as nursing or physical therapy, for example. Another challenge is the complexity of food supply chains, and you might have seen that a little bit in the image that Beth briefly had on her slide. There are many players, and the purchasing of goods by public institutions is regulated by institutional policies, provincial and federal regulations, and the Agreement on Internal Trade. I'm sure many of you know that hospitals most often source their food through group purchasing organizations, or GPOs, which negotiate contracts with suppliers and distributors, sourcing food primarily from the broadline supply chain. Hospitals can choose to source a percentage of their food outside of GPOs and broadline distributors, which allows flexibility to source directly from local producers. However, there are numerous challenges to food sourcing, and while GPOs assist hospitals to manage this complex system of food purchasing, there are areas for improvement in this space. And we'll talk about more of that in our issue brief. People are talking more about local foods, and as Beth gave some good examples of that in her presentation. But generally, I'd have to say commonly accepted definitions are lacking, and this impacts agreed upon metrics or tracking mechanisms to measure the use of local foods. And it's much the same when people talk about sustainable foods. We're also hearing more about values-based supply chains that attempt to meet both volume and scale requirements at the same time as meeting goals of alternative food procurement initiatives. Changing demographics impact food, and this inevitably influences hospital and healthcare food choices. We know Canadian patients come from a wide variety of backgrounds and cultures with various food preferences. Older folks often want different foods than younger patients, and many Canadians are also becoming more interested in healthy foods and their origin. So changing demographics definitely impact hospital food. In terms of laws and regulations and policies and directives and standards related to food and healthcare, our interviewees described frustrations associated with overlap, gaps, applicability, jurisdiction, and more. Suggestions included both more and less regulation of food, policies that enable rather than hinder changes they seek, the development of a national food standard, implementation of new accreditation standards for food service in hospitals, and more clarity around relevant definitions. Some concerns were also raised with respect to the impact of trade agreements on public procurement contracts. So I don't think that advances in this domain will happen quickly, but with ongoing support and pressure and advocacy, I'd expect we're going to see eventually some important changes and modifications in this area. Interestingly, some key informants mentioned the Canada Food Guide itself, which is currently under revision, and there were comments that this tool is perhaps unrealistic for many patients, including those who are very unwell, lacking appetite, or who need smaller food portions. Now, all that said, stakeholders did say that change is afoot. Food service staff and managers care about food served to patients. Patients are acknowledging good food and suggesting areas for improvement. And administration and senior leadership are taking notice. There is an understanding that healthy, flavorful food and a positive food experience contribute to patient satisfaction and may also positively impact quality of care and patient outcomes. Many stakeholders seem committed to creating value through nutritious and healthy food and to making a better connection between food and health. And this also applies to food served to staff and visitors in retail settings and hospitals, and I'll come back to that point. As anchor institutions rooted in their communities, some key informants indicated hospitals should be role models for wellness and that hospitals have moral authority in relation to providing quality hospital food and taking action to support the health of their communities. So some of the trends we uncovered, I'll start with patient food experience. There is an increased understanding that patients need nutritious, appealing food in order to regain their strength to heal. Patients are more likely to eat foods that taste good. Key informants supported simple hospital menus with enticing, healthy offerings that patients want to eat. We heard that food services in hospitals can certainly provide a small touch of normalcy in a patient's daily routine. Hospitals are regularly assessing patient satisfaction with hospital food, whether through proprietary, provincial, or regional surveys. Interviewees indicated there is a need for validated patient food satisfaction surveys that can be used across regions or maybe even the entire country to obtain patient feedback, determine best practices, and benchmark against. As organizations dedicated to health and healing, we know that hospitals can model the provision of healthy, nourishing foods and environments that encourage food consumption to help strengthen and heal patients. Unprompted, the majority of key informants noted that food is medicine. Some interviewees indicated that food service staff want to be part of interdisciplinary patient care teams, much like dietitians and nurses. The importance of good nutrition cannot be overstated, especially when it comes to recovery from illness, and Bill Saul already alluded to this. Studies have shown that malnourished patients stay longer in hospital and are at higher risk of readmission. Interviewees voiced a strong desire to address this risk through appropriate, appealing, and nutritious food. Now, we know that not only do we need nutritious and tasty patient food, we need the food to be culturally appropriate. Providing food that is more familiar to diverse groups of patients is a matter of respect, and it can help to increase patient satisfaction and reduce food waste. Many hospitals have begun to address this, and food manufacturers and distributors are making more efforts, I'm told, to source and provide culturally appropriate foods. Culturally appropriate food is obviously very significant for Indigenous people, and Bill Saul already talked about this a little bit. Traditional foods such as game, fish, berries are very important from cultural, spiritual, and nutritional perspectives. Canadian laws and food regulations often present barriers to the use of traditional Indigenous foods in hospitals, mainly due to concerns about food safety traceability. However, there are examples of traditional foods successfully and safely incorporated into hospital menus, and Beth mentioned this too, and I'll come back to this when we talk about innovations. Key informants discussed the noticeable interest among food service managers to increase the amount of fresh, in-season foods and decrease reliance on prepackaged or more processed foods. So while a widespread return to scratch cooking I don't think is likely, mostly because most hospitals don't have the facilities to do so anymore, many hospitals are exploring more conventional cooking and attempting to use healthier ingredients, foods, and cooking methods. We heard that one way to increase the amount of fresh food in hospitals is to redesign menus and identify local in-season foods that are available, and many food service managers are trying to demonstrate the value of local foods. It's apparent, though, that it will take time and resources to pull away from the current dominant integrated model of food procurement, and there will be bumps along the way. When asked what local food producers need to do to support more local and sustainable food and healthcare, key informants commented that local food producers should learn about how the healthcare food system functions, including the RFP process, and they should ask questions of GPOs. Local producers must meet food safety and health regulations, and we heard they may need to seek incentives to scale up or collaborate with other local producers to meet supply and demand needs. Champions of healthy and good-tasting food in hospitals recognize that food purchasing decisions impact the environment and surrounding communities. A relevant example would be balanced menus that lead to perhaps reductions in meat purchasing with savings used to purchase more sustainably produced foods. Antibiotic resistance as a food safety and food procurement issue is also mentioned, and it was suggested that hospitals and other health system stakeholders should call for an end to routine antibiotic use in animals. Healthy food in healthcare pertains not only to patients, but also staff, visitors, and the surrounding community. We heard about hospitals making efforts to increase the nutritional value of retail food offerings in cafeterias, gift shops, vending machines, and on-site franchises. In this way, hospitals can be role models for health and help to improve the food environments in the wider community. So what about leadership? While the role and impact of food and nutrition is sometimes overlooked, a number of hospital leaders are paying attention to the value of food and nutrition. Executive-level champions have a role to play in helping to define food-related goals, how they link to the organization's strategy, and of course, resourcing. Leaders must also insist that food-related performance indicators are monitored on a regular basis and improvements made as necessary. While some may still see food as a utility, other leaders increasingly appreciate the importance of nutritious, appealing food and what it can do for their patients, staff, and communities. Clinical champions can also help to profile the importance of healthy nutrition. So within hospitals, physicians and other clinical champions such as dietitians can legitimize messages in support of healthy foods. Clinical champions can also speak to the impact of the social determinants of health, including income, education, and the physical environment, all of which impact or influence food choices. Most agree that leadership buy-in will expand as more research and evidence regarding the value of food and nutrition in healthcare becomes available. Questions related to food and patient experience, nutrition and patient outcomes, hospital food waste, and food costs per day are just some of the areas requiring additional research. We also heard about the impact of hospital food choices on communities and on sustainability as areas needing more attention. And further research regarding the effectiveness and efficiency of the food supply chain may be valuable. So now on to some innovations and good news stories from within our hospitals, and even more will be highlighted in our issue brief. So we heard about alternative models for serving food to patients that have become more common over the past decade or so. These include restaurant-style menus, on-demand dining, room service, and some hybrid models. Many key informants indicated these innovations positively impact patient satisfaction and help to reduce food waste. In sectors including mental health, rehab, and children's hospitals, approaches that enable patients to make choices about their food or even prepare or select their food in serveries are expanding. In terms of creative partnerships, there was a good example of a Toronto area hospital teaming with a local college to create a guide for hospital kitchen staff to learn the how, where, and when of local food purchasing and preparation. We also heard about therapeutic gardens, whose produce is used in hospital kitchens for meals and also in cooking sessions with patients. We learned about hospital farmers markets, which provide a visual connection between food and health and a reminder that food contributes greatly to overall health. In terms of meeting the culturally appropriate food needs of Indigenous peoples, BC's Haida Gwaii Hospital and Health Centre has developed a policy to bring in traditional foods once a month for social or cultural events, and they now have a policy for using donated CIFA-approved fish for patient consumption. And we'll provide other examples of addressing culturally appropriate foods in the issue brief. And while not the first province to do so, the Quebec government has developed a local food strategy for the institutional market, focused on bringing more local produce into public institutions. Today, 33% of Montreal's health facilities ask their suppliers for local produce. From the retail perspective, a valuable example is the 20 hospitals in the Champlain region of Eastern Ontario that have signed on to the Healthy Foods in Hospitals program. This program is grounded within a set of nutritional standards created by dietitians from hospitals and public health, which hospitals move through over time. And I won't talk about the Nova Scotia experience now because Brenda MacDonald will be sharing some great innovations from that province. And what about some other countries? Hospital food and nutrition in the United States is also evolving. While our healthcare systems differ, there are some thought-provoking U.S. initiatives to learn from. For example, as part of Healthcare Without Harm, many of you probably know that as the worldwide initiative or collaborative campaign for environmentally responsible healthcare. Many U.S. health organizations have signed the Healthy Food and Healthcare Pledge. Those that sign the pledge agree to increase the offering of fresh fruits and vegetables as well as other healthy foods, identify and adopt sustainable food procurement options, including local food sources, request info from group purchasing organizations about the sources of hospital food purchased, and they also agree to minimize food waste. Another example is Kaiser Permanente, an integrated managed care consortium, developed a sustainable food scorecard to evaluate potential food and food service vendors' ability to support its sustainable food purchasing initiatives. I found that very interesting. And a group of hospitals in the San Francisco Bay Area have launched the Farm Fresh Healthcare Project to increase sourcing of local and organic produce from small to mid-scale farmers. I think the lessons learned, though, I think can really apply. They note the importance of common definitions, food service champions, pooling purchasing power, incorporating seasonal produce into menus, supporting smaller-scale farmers to become food safety certified, and increasing supply chain transparency. And what about the United Kingdom? The UK has adapted the Council of Europe's key characteristics of good nutrition and hydration care. These include, they're not limited to, but they include screening patients for malnourishment or risk of malnourishment, creating a care plan enabling patients to have choice and control over their own nutritional care and fluid needs, and providing food and drinks alone or with assistance in an environment conducive to patients being able to consume their food. We heard that dietitians, nurses, and food caterers in the UK work collaboratively to ready the environment and deliver food to patients, and they aim to protect mealtimes by disallowing non-essential activities during meals. This official NHS initiative is known as Mealtimes Matter. The UK Soil Association offers what is called the Catering Mark. You may have heard that Catering Mark Inspected Award for patient food that is sustainable, fresh, free from additives and trans fats, and that meets nutritional guidelines. We learned that more than 10,000 meals are served in hospitals every day in the UK that meet the Catering Mark Best Practice Bronze standards. And through the course of my key informant interviews, I did hear about some other innovative hospital food initiatives in countries beyond the US and the UK. So these are out there for folks wanting to learn more. So this is my last slide. While the provision of a nutritious, appealing, and sustainable food in hospitals may have a ways to go, I think it's safe to say advances are being made. There are still many concerns and issues to manage. However, hospitals are working to find their way through these. As hospitals move forward with their efforts, there will be improvements in the sourcing, production, and delivery of nutritious and good-tasting food. The more hospitals work together, discuss their learnings, and share good practices, the more progress will be made. Interest in fresh local foods is growing, as is a food for health approach in hospitals. Some facilities are more aware of and are seeking to address environmental concerns regarding food and are becoming more in tune with their role to help build healthy communities. We learned that more research evidence and senior leadership buy-in are required. We heard that food is medicine. It is part of healthcare and not a utility, and leaders will be called upon to help build a healthy food and nutrition culture. And patients, staff, families, and physicians must be part of this journey. We heard that loud and clear. And I'll close my part by saying that we hope hospitals and healthcare organizations in Canada will start or continue to rethink their connection with food as an essential healthcare service and as an investment in the health and well-being of patients, staff, and communities. Back to you, Jennifer.
Thank you very much, Tracy. I just want to say, that was a great overview of the research. I want to point out we've had an excellent steering committee that's guided our work, and I know that some of our steering committee members are on the call. And I'm also very grateful to their guidance, but also the key informant interviews who have helped us to get all this information. I also want to tell all participants that the paper will be finalized in June, and to keep the dialogue going with all of you, we will undertake to send that out to you in the mid to end June, just so you've got the full document at your disposal. I'd now like to turn it over to Brenda MacDonald. As I mentioned, she comes from Nova Scotia, and she's worked within both IWK and Nova Scotia Health Authority. Brenda is currently the Senior Director of Nutrition and Food Services. And Brenda, over to you. Thanks.
Thank you, Jennifer, and thank you to Healthcare Can for letting us share our Nova Scotia experience today, and also thanks to the J.W. McConnell Family Foundation. We know there's lots of inspiring work being done throughout Canada, and we're just so pleased to share a few of our experiences over the last few years. So it's an exciting time for those of us who work within nutrition and food services in healthcare, and we know that there's an increased recognition in food and nutrition's role in health and recovery, and I know I speak for lots of folks that are listening today, is we dietitians have been waiting for this for a long time. So just so sorry, I think I went by too quickly here. In nutrition and food services as part of the Nova Scotia Health Authority, our mission is to make food and people healthier through a culture of nutrition. So in trying to do that and move forward with that, we have done lots of things within our province, and we're really proud to chat a little bit about our room service model. So the Canadian Malnutrition Task Force from 2014 tells us that 45% of patients are malnourished. 47% of people actually leave our hospitals malnourished. So they're coming in, 45% are coming in malnourished, and 47% are leaving malnourished. We know that we have lots of work to do, and in Nova Scotia, one of the things that we're trying to do in order to combat this malnutrition is implementing room service within many of our hospitals. So to date, we have 6 of our regional hospitals who have implemented the room service model within our food services for our patients. And a room service model basically lets patients to either pick up a room, or a food service folks will meet with them and order their food. So they order their food, and the food order comes within food services, and in 45 minutes the patient gets their food. So that really gives a lot of patients the opportunity to eat what they want when they want it, and of course gives patients control. So room service giving patients control at a time when they're in the hospital, when there really isn't a lot of control that a patient has. So this way, by ordering what they want, when they want, if they know they're going for a test, they're not going to order their meal. If they know that the doc's on the way in, again, they're not going to order their meal. If family are visiting, this might be the time that they want to order their meal, and they might their family may order a meal as well with them as a guest meal, and that encourages both the family and the patient to hopefully increase their nourishment. So before many of us switched to the room service model, there was an absorbent amount of food waste in our hospitals. So across our province, we stood, and it's not a fancy job, but we stood within the dish room and for a 2-week period, and we counted the waste that came back on the patient trays. And the waste, our food service people working in those dish rooms weren't surprised, but it was over 40% in many of our hospitals. And in some of them, that's an equivalent of over $500,000 every year. So it's quite a huge amount of waste to create. So with the room service model, we have found that patients ordering what they want when they want it, we've decreased waste to less than 10%, and in the IWK experience, it's actually less than 5%. And the difference, we believe, between the IWK, which is our children's and women's hospitals in Nova Scotia, as compared to more of the adult populations within the Nova Scotia Health Authority, between the 10% and the 5%, where our texture modification. So, for example, if a patient had dysphagia, so they had a puree diet and a mince diet. And thankfully, those little ones and the women at the IWK, we don't have so much of that there. In addition to the decreased food waste, not surprising, our patient satisfaction went up dramatically from less than 70% to well over 90%, and in some cases we had achieved 98%. So measuring the food waste, patient satisfaction is not a one-shot deal. We want to make sure that once we implement and we change anything, that we have the follow-up evaluation so that we can continue to constantly improve. So annually across the Nova Scotia Health Authority and the IWK, we're great partners. We annually do that fancy job of standing in the dish room and measure our waste for at least a minimum of a 7-day period. And we do that because we really want to continue to make good efforts and changes to meet our patients' needs and, of course, to decrease that malnutrition. In addition to our food waste that we carry out annually, the audit, we also do the same patient audit for satisfaction and experience. And we do that as well, using the same policy, using the same form, and we've done that for about 5 years, working collaboratively together before the Nova Scotia Health Authority, which most of our hospitals are part of, was formed. And again, the patient satisfaction, we compare why was the hospital in one area, had better satisfaction than in another, so that we can continue to learn from each other and make great improvements with the patient's intake. So not only did room service and does room service increase our patient satisfaction and the patient's family satisfaction, it also increases our staff engagement and their satisfaction with their roles. So staff are really proud of room service and being able to serve these meals to the patients. They go up to the patients, they deliver it in the patient's room, and before room service, many of our staff had never been in the patient rooms. We would drop the trays off to the nursing unit, and then the nursing would take care of that part. So with room service, we were able to negotiate with nursing because first they really didn't want to give up that job, believe it or not, but now we make the food and we bring it directly into the patient, and there's a lot of chatter that goes on between the patients and the staff, and there's a great ability for the staff to have accountability for that patient's intake. Before we had a room service model throughout our province, we would have issues with patient intake, such as we would send a tea without hot water, for example. We would serve milk, and we would give the cereal but without the milk. So with the direct feedback and the patients, from the patients, the staff who makes the tray actually deliver the tray, and that gives us great accountability. And one of the things that the staff often tell us is, they know what's going on. They're the front line, and it's very demoralizing for them, and they were all embarrassed with the large amounts of food going into the garbage with our traditional food service system. So they would see all of their hard work, all of that effort from the chef preparing the food to the assembly folks bringing the tray to the patients, and so then collecting the dirty tray back and washing it. So a lot of resources went into making that one tray, and when you're throwing out basically almost half or 40% of that tray, it's quite demoralizing. So room service certainly has increased our staff engagement. On from room service to our healthy eating policy. So for the Nova Scotia Health Authority, we do have a just approved healthy eating policy, and with this, the focus of our healthy eating policy is exactly what we've alluded to earlier in the presentations, is that we as leaders in healthcare and in hospitals, we must walk the talk. So building an environment that supports healthy eating is the focus of our policies. So we don't want to just focus on the negative, you can't have this, you're not allowed to have that. So we want to create an environment that is supportive of that and that is very positive toward healthy eating. So a long time ago, about 8 years ago, throughout the whole province, we replaced all of our deep fat fryers, which I have to say we did have until 8 or 9 years ago, with high heat ovens, and so we were able to provide some of those things that folks wanted to have, such as French fries, but we could get a healthier French fries that met our healthy eating nutrient criteria, and we could bake them and then slowly take even those healthier fries that we baked and made it more of a treat than a regular occurrence, for example, in our cafeteria services in retail. We also focused on the positive by having what we call BOGO. So every month for the past 5 years, we have had a buy one, get one day across the province where we all would either have a recipe made by one hospital and share it through the others, or would do an apple or an orange, something, fruit or vegetable, but we would all do the same product. And we would be able to really take those products and get them together, and with our buying power of everybody buying the same thing for a cheaper rate, and we're able to buy one, get one free. So another positive example of building a healthy environment that supports healthy eating. Salt Bike Request was one of the ones in the early days, so wanted to really make the impact of if we have things out in our cafeteria. It's very tempting in our retail locations, so if folks wanted to have the little salt packet, they had to ask the cashier for it. And so it was very simple, but seemed very effective. We also, and these are just a few of the ones we're mentioning, have farmers markets in some of our areas in retail. And as well, we have implemented last year what we call our hydration station. And the hydration station is at the IWK and soon to be in most Nova Scotia hospitals. So this is a little picture of it. Picture's worth 1,000 words. So we did this because we were removing sugary drinks from our hospitals. So that would mean, soft drinks and juices. And we wanted to really we didn't want to focus on taking the sugary drinks away. We wanted to be focusing on how can we do this to create a supportive environment. So we implemented this hydration station. So we met with our maintenance team, we drew pictures, we kind of made up how to make it, and it seemed to work quite nicely. And it is free fruit-infused water for anyone. So anyone can come into the cafe there and help themselves free of charge, and it's there all day long. So the interesting thing about the hydration station is it got so much media and press. We were quite surprised because really it's just water. But the most interesting thing is the amount of children and their parents who came up to us and said, I've never had water. It was just astounding. Yeah, it was just amazing. So with the successes that we've had at the IWK, we are moving forward throughout the Nova Scotia Health Authority to, again, learning from each other to implement the hydration station. Additionally, we know there's lots of great work being done throughout the country, and we have many partnerships, and one of the partnerships that we have is a partnership for local food, and happy to be part of the Nourish cohort that you heard Beth speak about earlier. In addition to that, we have some collaborative partnerships happening within our province with the Ecology Action Centre, Department of Agriculture, universities, Department of Health and Wellness, and Public Health, just to name a few. And our goal is to increase our healthy, local, and sustainable food in publicly funded institutions and to learn from each other. In order to do this, we're a small province, so doing things together is an absolute necessity. In conclusion, these were just a few of the experiences in Nova Scotia that we've worked collaboratively for, and our hope is that together we can create a nutrition culture where food is truly valued for its role in health and recovery. Thank you.
Thank you very much, Brenda. That was a terrific description of some of the best practices that you've seen, and we're actually a team of us is in the office here at Healthcare Canada discussing many of the issues that you've raised. So thank you for that, and some of those points actually we're going to bring forward to our board meeting this June. I just want to say I had mentioned we're really struck by the level of interest. We've had all of our participants stay on throughout this webinar. We really appreciate that. And if there's any questions by any of you, please type them into the Q&A pod, and we'll ensure that any questions are answered after the fact. We'll get back to you about that. And once again, I want to thank Mr. Bill Saul.
I have one quick question.
Oh, sure. Go for it, Bill.
It should only take a minute, but Brenda, to your presentation, thank you so much. I mean, Nova Scotia and Capital Health, before there was Nova Scotia Health Authority, there was Capital Health, has done a lot to kind of move the yardsticks on nutrition in hospitals. Are you familiar with the process by which Nova Scotia sort of took on Tim Hortons and won in terms of getting donuts out of your hospitals and keeping the coffee but getting rid of the donuts?
Yeah, I am familiar. So Tim Hortons has been a partner in the, I think the former Capital Health for a long time, like decades, in fact, as well. And it came at a time when, that was kind of the trend, was to get a lot of those franchisees in the hospital, because our goal back then was to, make some profit and put that profit back into the hospital so that we could cover the cost of care. There is also a Tim Hortons located at the IWK as well. So those are the only two sites that we have Tim Hortons currently. So there was a lot of work done by the former Capital Health to work with the Tim Hortons franchise in order to build a menu that certainly would, it didn't meet the nutrient criteria per se, but certainly took out a lot of the really high-fat, high-sugary products. And Tim Hortons have been, and I've worked with Tim Hortons just in the last few years, and they certainly have been a real true partner in understanding that this is where we're going. And so, whoever's going to go with us on this journey as contracts come up, we are putting language in all of our contracts, basically saying that there will be a healthy eating there is a healthy eating policy, and you must follow the healthy eating policy. And so, when it's one of those, if you don't follow the healthy eating policy, then it would be cause for termination of contract. But so far, all of our vendors have very much want to walk the journey with us, and that is one of the reasons why we have to keep that coffee.
Thanks, Brenda, for sharing that. And I just wanted to raise that question as a concrete example of what Canadian hospitals can do to try and create healthier, more nutritious environments by working with the retail industry. So thank you for that. Thanks to everybody, and back over to Jennifer.
Okay. Well, thank you very much. I want to thank our 4 presenters today. It's been a very rich webinar today. So to Mr. Bill Saul, Ms. Beth Hunter, Ms. Tracy Murphy, and Ms. Brenda MacDonald, I want to thank you for taking the time to present this webinar today. I really want to encourage all of our participants to fill out the evaluation form, which is on your screen. You just need to click the link. Very simple evaluation form, which you're used to seeing, but also there's a couple of content questions on the theme of the webinar, and we'd like to hear from you. As we mentioned, anything that you send to us will be, Tracy will review in terms of her final draft of her research project. So please take a few minutes to fill out this evaluation form. So I want to thank everyone for attending today's webinar. I think it's safe to say that you found it very informative, as we didn't have any drop-offs throughout this webinar. And I want to wish everyone a very, very pleasant afternoon. Thank you.